Hi guys, it's your favorite nurse educator, NP Clark, and I'm back with another cup of the morning coffee. In today's cup, guys, we are going to help out new nurses or nurses who've been nurses for a while, but we're going to talk about doing an admission. And this is whether you're in the hospital, long-term care, assisted living, it doesn't really matter, but any patient that is new to you. And even if they are readmission, somebody that's returning back from the hospital or maybe went home for a bit and now they're back visiting you. Just some tips and how-tos, things that providers such as myself look for. Hopefully this will help you guys out. Now, let's get started. So for any new admission, sometimes you are not the nurse that received the initial report, although you are completing the admission. So sometimes your report that you received before is based on that nurse's experience. But if we all get more clear directions and information from that initial assessment that was done, this will help us all. So what I'd like for us to focus on is when you get the discharge paperwork, excuse me, I'm kind of a little off-centered, so here we go. All right, so when we get that paperwork about the patient that is in, or that initial history and physical, whatever you guys call it, in your place of work, you want to go through and make sure that this is the patient that is listed in here. You want to make sure that's the right name, right? That they look their age, and even if they don't, because we know some people don't, but you want to verify that that is this patient based on age, name. Ask them where they're coming from, right? Because some people are coming from home, so you know that there's going to be a transitional period. Or maybe they came from another facility, and maybe the facility was a 5-star posh Beverly Hills retirement home, and now you are a inner city, a little less posh facility. So there's going to be some transition there that we need to assist the patient in doing. Also, once you guys get the information, the main thing that I see that is happening now is there's no reconciliation between medications and conditions or diagnoses. There's no reconciliation between that. And it's imperative because as the provider that you're calling to reconcile the medications and get my approval to continue on what the previous place did, it's important for me to know if a patient comes to your facility and is diabetic, where's the treatment for that? There would be labs that I want to order on admission so that we can get a baseline like a A1C, right? So because we want to know what is this patient's history. Just because a person can talk and appears to be alert and oriented times 3 to 4 does not mean that they are alert and oriented times 3 to 4 or that they don't have any memory issues. So, ladies and gents, we want to make sure that we are reconciling diagnoses with the medications. If you have a diagnosis but no medication for it, we need to get a further history, whether you get collateral information from a friend or family member of the patient, or the patient is able to give it yourself, or you need to look a little deeper into those hospital records, right? Because what we know that happens is a lot of polypharmacy and polyhospitals. Patients may have lived on the north side of Chicago or wherever you live at, and now they are on the south side, east side, west side. And so sometimes things get lost in translation. So it's your job as that admitting nurse to kind of put that story together. As the provider, I'm not in the facility, and at times I may not even see the patient, depending on the setting, for 1 to 2, maybe even 3 weeks. So my assessment and care for the patient can only be as good as yours. Now, after you've done that reconciliation of diagnoses and medications, you also want to go and see how does this patient take care of themselves. What level of care can they give themselves? Because if the patient came in and they can do everything for themselves, and in 3 days they're lethargic, they're tired, they are now one side of their body is weak, that triggers us to say that there has been a change in the patient's condition. And that's very important, right? Because how many times do you come in and the nurse before you says, oh, well, this is my first time working with the patient, but they've actually worked 8 to 12 hours, but still don't have any information to give you. So, as nurses and as healthcare providers and other ancillary staff, it is our jobs that every time we see these patients, you're assessing the patient and getting to know that person, right? So, after you've kind of gone through that, I always like to go through the physical therapy or any other therapies, any other department's notes, and see how the patient was with them. Because if everybody's stating that this patient can walk and all of a sudden the patient can't walk with you, that is something that we need to be aware of what has happened. You may be able to trend some things. Maybe every day at 4 p.m., the patient gets a little wonky or out of sorts. Well, we know that in older patients or patients with dementia, that can signify, right, some little sundowning. So we just want to make sure. Now, sometimes you have patients that'll come in and they have history of substance abuse, alcohol abuse, things like that. So what do we not want to do? We don't want to leave their medication, such as a Xanax or anything like that, at the bedside for them. We want to ensure that they take it, watch them swallow it, and maybe even stay a couple of moments to ensure they have not vomited back up, to build up several pills so that they can unfortunately get high later. Or we need to recognize if a patient is asking for a lot of mouthwash and things like that we know in our facility contain alcohol and they have a history of alcohol abuse, we want to ensure, guys, that we are monitoring and managing that and educating the CNAs, because they may not know. Now, a lot of CNAs, they usually know the patients much better than we do on a personal level. But that's why we are a collaborative team. And that's what I'm always going to pressure you guys into doing. And yes, I mean pressure, because we can't do it by ourselves. Whether you're the nurse, the physician, the nurse practitioner, the PA, the CNA, the social services director, physical therapy, we all work together to provide the best care that we can for our patients, right? Now, the final thing that I want to say here is this. If something doesn't feel right or seem right to you, it never hurts you to ask. And even if the person you're asking doesn't have an answer, maybe you guys can come together as a team, or you can reach out to a provider. But we need to make sure that we are on top of things, guys, right? Because what we know is we're all overworked right now. This has been a rough 2 years, and the world just finding out what we've been doing for years, decades. Right? We've been dealing with all these pandemics behind closed doors, and the world was just made privy to that. So I get it. I understand you guys are overworked and feeling underpaid, not feeling the gratitude. Yes, I'm with you. I'm tired of pizza parties myself. However, we became nurses and healthcare staff in order to make sure that we provide the best care and get the best outcomes for our patients, which one day may be us. We're all just one accident, one fall, one stroke away from being a patient. Now, ask yourself, do you want to be the healthcare provider, clinician, nurse, aide, physical therapist, or whatever? Even if you work for a pharmaceutical company, guys, do you want to be the person that, hey, I had a bad day, and so this is all this patient's going to get from me? And the truth is, no. You wouldn't want that care for yourself, for your loved ones, for your children. So let's do the best that we can do. And even if we have to reach out and get help from others, that is totally fine. There's nothing wrong with that. And as I always say, make sure that we're doing healthcare self-care. Oh, that's a good one. I'm going to have to use that. Healthcare self-care. We've got to, guys, start doing some things for ourselves to ensure that when we get out on those floors and we are caring for these patients, that we can do everything possible to give them the best care. But it starts with these admissions. Whenever, guys, you have a new patient, this is where you have to do your due diligence and getting all the information that we can get. So, this has been another episode of The Morning Coffee with NP Clark. Thank you.